Good morning, everybody. I call to order the meeting of the Academic Health Committee of the University of Minnesota for the Board of Regents. Thank you to those who are joining us by live stream video and those of us who have joined us today in the boardroom at the Twin Cities campus and via Zoom. Let me welcome our student representative for today, student representatives, Tewo Aramu, who is his last Academic Health Committee meeting today. And Tewo has been just a wonderful committee member and a wonderful advisor, quite honestly, to me personally. So Tewo will miss you tremendously. And we also have Pete Smith, also from the Twin Cities campus, who I believe is on Zoom. So welcome, Pete. We're going to have an agenda item today that talks about how we are helping to perform in greater Minnesota with our CentraCare relationships. But prior to that, I wanted us to provide an update on the ongoing work to shape the future of academic health and the partnerships required to do this in a robust way for all Minnesotans. So we have an ever-present obligation at the University of Minnesota about how our schools of medicine, nursing, public health, pharmacy, vet med, and dentistry can continue to fill our responsibility to employ academic medicine to advance the public health of the entire state. As you know from the last meeting we had in the academic health, where the strategic facilitator Lois Quam, who was appointed by the Attorney General, came to talk about it, we really appreciate the involvement of both Lois Quam and the Attorney General in shaping that future. We can report that Facilitator Quam is working diligently to meet with the parties and think through how the nonprofit and university entities involved can best serve patients throughout the state. The university's focus, of course, is its public mission and public responsibilities. The University of Minnesota Medical Center needs to provide a strong foundation for patient care, for research, and for professional training, wherein 70% of the professionals trained for the state stay within the state. The process is underway and is a healthy vehicle for strategic discussion among the university, Fairview, and Essentia as to how best to serve the many public and patients' interests at stake. I'm wondering if President Cunningham, you want to make any additional comments as well.
Thank you, Chair Wheeler. And first of all, I have to just back up and thank Tewo tremendously as well. It's been wonderful to get to know you this year. It's my first year, and you've been a wonderful advisor to me as a new president. So we wish you the best, Tewo, going forward. In terms of the importance of our health strategy and initiatives here going forward, I want to echo your comments. The university's mission and the medical school mission here remains ever important, and we are working with urgency, as strategic facilitator Lois Quam noted last month, on the importance of ensuring that our physicians are able to proceed with their important work, as well as our researchers and the health of the state, all of which is at stake here, which we are working on diligently every day. Thank you so much.
Thank you very much, President Cunningham. With that, I think we'll move to our agenda item for today. The CentraCare presentation is yet another example of how the university matches up with a valued healthcare partner to serve greater Minnesota patients. We're really thankful for the vision that CentraCare expands the reach of the medical school's residency program to better serve West Central Minnesota. So let me welcome Ken Holman, CentraCare President and Chief Executive Officer, and Mike Blair, CentraCare Senior Vice President and Chief Financial Officer, who along with Vice President Toller will provide the presentation. Vice President Toller, will you help us get started, please?
Thank you, Chair Wheeler, Regents, Madam President. You know, it's a delight to be here, of course, as always, and you have heard us talk about the health sciences programs. You know, Chair Wheeler and I and Dean Delaney were on the task force of the governor. You know, this has obviously been a huge priority for the medical school and other health science schools. Now, it has been most clearly articulated by our president. We are looking at all of the Minnesota health broadly, and we are focusing on workforce development, which basically translates into access. The newest regional campus of the medical school is in St. Cloud. As you probably know, this is one of the biggest steps forward in addressing the shortage that we have around the state. And this has truly been made possible by the brain and commitment of Dr. Holman, who has been leading CentraCare, of course, as you said. And I have learned a great deal from Dr. Holman over years, and it's true that he's that rare individual that's motivated by the right things. Not only that, doesn't stop there, but he actually is a man of action and gets things done. And you'll hear the results of this today. Next slide, please. This is the why slide. You don't need me really to tell you too deeply why we are doing this. We were over this. It is the aging population, not just the Minnesotans. It is the physicians. 25% of the physicians in the rural area will retire by 2027. And but it's more on the heart level, who we are, why we are here, and serving this university, serving the state in solving the problems on public missions, as in this case. And Dr. Holman and I and our team have put it together in a very simple way, because everybody knew how to do this. You get the students from rural areas, you train them in the rural areas, and they will come back home. And the challenge has been, of course, that very few places have done this. So the partnership with CentraCare and this university is absolutely unique. And the partnership that has been built, gotten support from you, Board of Regents, and I'm grateful for that as well. And it spans the undergraduate training of the 4 years of the medical student, but it also carries with her to the residency training, which is the graduate medical education, which we are working on as well. And it dovetails with a research institute that shares in the innovation that the medical school provides. So I've asked Dr. Holman and CFO Mike Blair and other essential partners of ours to present the details about all that we have accomplished with our teams. Our new regional dean, Dr. Chris Fowler, is also here. Also people on the CentraCare side, Assistant Dean Amsbury, Dr. Schrupp, Joe Plemon. There are many, many people that contributed to the success of this endeavor. Ken, my friend, your floor.
Thank you, Dr. Toller, Chair, President, Regents. I'm going to go sideways for a minute and pick off the why slide. So I want to maybe have you think for a minute about a 22-year-old that just got a call from Chris Fowler, accepted to our medical school. Think about that. I want you to think about a farmer who's driving his John Deere tractor and has a stroke. I want you to think about a 19-year-old unwed mother who's pregnant and needs access to health care. I want you to think about the challenges that our state college system has in outstate Minnesota. I'd like to have you think about how Main Street in rural America is being challenged with big box stores, Amazon. And so the why for us certainly is about health care, but it's about other things as well, and I might just check them off. Education. The continuous pursuit of learning. How do we stay curious? In this rapidly changing world, curiosity is essential. Your support of this celebrates curiosity. Secondly, it creates an economic engine for our rural communities. It is quite profound. For those of you that are from small towns, you know that community pride resides in the Forest City High School Warriors, right? The athletic teams. And the hospital and Main Street. And so this notion of how we celebrate the richness and the cool things about rural healthcare is extremely important from an economic development perspective for generations to come. Additionally, for each physician we train, there's another 11 to 12 to 13 folks that we need. They are pipe fitters, they're electricians, they're nurses, they're LPNs, they're IT people. And so is this about creating a pathway for new physicians? Absolutely. But it's far richer than that. And in this thread, I would finish with this note. This has all of a sudden in outstate Minnesota, have us recognize that we are the engine that did, not the engine that couldn't, but the engine that did. The remarkable support as our leaders go out, and Dr. Fallard has been to Centricare land the last few months here, visiting all the small towns we serve. There is enormous pride in this project. So as I go from the why, I would finish with the one simple message that I hope you take with you today. Manga tusen tak. So my Norwegian mother from a small farm in Iowa, that means many thousand thanks. This notion of how we, when we're full of, PowerPoints, balance sheets with zeros omitted, strategic plans, even politics, how do we understand the necessity for us to have a focus on our patients and our communities? And for that, Centricare, our communities, the 43 counties we're in, the 750,000 patients we see, and our 12,000 team members, we say, thank you. So thank you to you, thank you to the legislature, thank you to the Centricare team. Special thank you to Jacob and his team, who have been marvelous partners that took probably a stupid idea from a small town kid from Iowa called Ken and made this happen for our communities. So thank you, Jacob. And with that, I turn it over to Mike to get to really the heart of the details that you're looking for. But I would finish again with reemphasizing, how do we serve our communities differently and better? And number two, thank you. Michael.
Well, good morning, Chair Wheeler, Regents, President Cunningham, and my friend Dean Toller. It was back in 2021 when Dean Toller, Dr. Holman, myself, and Emily Lawrence gathered in Dean Toller's office, and we had a clean whiteboard, and we said to each other, what would be something that collectively we could accomplish that neither one of us could accomplish on our own? Like, what would be something transformative that neither one could do, but if we came together, we could do that? And we did that. We created a regional campus that's focused on educating physicians who will go on and practice in outstate Minnesota. And it has been an enormous success. We have 24 students arriving here in August. Regional Dean Fallard back there will have the pleasure of welcoming them to the community. 24, all of them are coming from outstate Minnesota. All have expressed an interest in practicing in rural Minnesota. Another fact, we extended 24 offers. We got 24 acceptance, 100% acceptance rate, which is unheard of in medical schools. And I'll tell you what I find is just a great example. We have 3 incoming students, and these 3 incoming students, 2 of them spoke about being on a family farm. They're a key part of that family farm, and they said if we did not have a campus in St. Cloud, I would not be able to go to medical school. You know those 2 are gonna stay out in the rural community. The third one, primary caregiver for a special needs family member. She said, I can't leave the community. Like, I am the primary caregiver. If I had to go to the Twin Cities for medical school, I would not go to medical school. She can go to medical school now because we created this. And you may recall 2 years ago, I was here speaking to this same committee, and I spoke about the trust that we had between the 2 organizations. Dean Toller, Dr. Holman very much have a trusting relationship. Shaili Prasad, Dr. Prasad, who's my co-chair over the governance structure, we have a very trusting relationship. The entire governance structure is a dyad model where a Centricare leader is paired with the university leader, and we've created that same level of trust across the organization. And part of that is we spoke originally as a governance committee that we were all on that committee to advance the mission, not to represent our own organization. And it is not unusual in those governance meetings to have somebody who's advocating for something in which someone on the outside would say, you're advocating for the other side. And we're like, well, there's no sides. Like, it's the mission. That's what we're all advocating for. And so you also asked me, well, Mike, let's say the state does not provide any funding for this initiative. How are we going to fund it? And I remember saying at this meeting, Dr. Holman and I are fully committed to this. And we believe the state should provide funding for this. It is for a state betterment. But if they did not, we would step in. And we did. We have spent $19 million to open up the facility. It's a beautiful facility. It's still coming together. It's all going to be ready, they assured me, even though we're still doing construction. It's a wonderful looking facility. And we spent $21 million building housing attached to it. We want to build camaraderie with that incoming class. We want them to live together. They don't have to, but they can live in that facility. And we all kind of think back to, well, when I went to the university, I remember having a dorm room where you're sharing with somebody else and the bathrooms are down the hall. This is underground parking. It's anywhere from studio to 3-bedroom apartment. It's got a sport court. It's got a dog park. It's not like the old housing. It's something new that people are going to want to live in. We also committed to Dean Toller that we would cover the net operating costs. So the structural deficit of that regional campus, we are committed to covering that, and we will. And we project out what we think that's going to look like over the next 10 years, and that will be about a $10 million commitment from us, and we are fine doing that just because we see that we also have a key part in advancing this mission. Now, I will tell you, as Dr. Holman said earlier, I cannot tell you how exciting this is out in outstate Minnesota. And we have a $50 million philanthropic campaign. We've already raised $30 million. Like, we just started raising money a year ago. This is really well received. And what's really neat about that campus, in retrospect, I should have brought a picture. It's adjacent to our ambulatory site in St. Cloud. It's a 600,000 square foot facility. We're putting $300 million into that facility right as we speak. It's the biggest construction progress in central Minnesota. So not only will those students be in a state-of-the-art facility, have housing adjacent to it, they will walk out and see a large complex care. Like, they have the chance that they want to go over and tour through the clinic. They're going to get immersed from day one on what it means to practice medicine. Now, we'll also mention that this has been very well received by the state. Bipartisan, we have bipartisan support, bipartisan bill writing. We did get $5 million from the state for the facility. We got $10 million for the startup costs. Fortunate for us, Vice Chair Senator Putnam of Higher Ed, he's our senator, and he's a very big supporter of it. Also, Rep. Wolgamott, who's co-chair of the House Higher Ed, he's a co-sponsor of the bill. Representative Perryman, who's a Republican on the side, sponsor of the bill too. So it's been a bipartisan initiative, very well received. But we also talked about, the medical school is so critical to start educating physicians. But the reality is, if you educate them at the St. Cloud campus, and then we say, well, now go do your residency program. Like, why don't you go to the metro? Or maybe go out of state. But when you're done, come back. Well, we all know that the possibilities of them coming back go down dramatically. Because they may have a family, they may go get established over their residency, and now you're asking them, well, just pick up the family and move back. Or they may go to the health system and say, well, I have a job here now. I think I want to stay here. So we also committed that we had to come together, once again, to do something that neither one of us could do on our own. So we currently have a family medicine program. It is sponsored through the university. We've graduated 118 doctors since 1996. 82% of them are practicing in Minnesota. 77% are practicing in outstate Minnesota. So we've demonstrated if you train them in a rural area, they will stay in a rural area. And 51% are practicing in rural communities of less than 25,000. And so we committed really to two things as a group. One is we would not strand at graduating physicians, which not all of them are going to train with us. We know that. But we want to make sure that if we're graduating 24 every year, we need to have 24 residency spaces. And so if the average residency is 3 years, 3 to 7 years, but 3 years, and you're graduating 24 every year, that means we need 72 residency slots. So we committed to growing from the 18 up to the 72. And the second commitment we made is we are going to focus on specialties that have shortages in rural Minnesota. So that's family medicine, it's internal medicine, it's pediatrics, it's psychiatry, it's obstetrics, and it's general surgery. And I'm going to go back and talk about 2 of those because this is one more example of being able to do something collectively that neither one of us could do on our own. Here's the reality. We need more pediatricians out in outstate Minnesota. We don't have a children's hospital. They need exposure to a children's hospital for their training. So what we created was a program where they will start in the metro at the children's hospital, and then on their 3rd year, they come out to Centricare, and they will do their last year out in Centricare. And we're going to seek individuals who have an interest in practicing outstate, recognize they're going to have to do a couple years in the metro, but will finish their 3rd year with us. Psychiatry is also a great example. And we've come together with the university around the psychiatric program. And what's really neat about this one is that they're going to do work down here in the metro. We also have the VA on board. We have a DHS on board. We've got some of the other local sites on board too. So they will come out and they will do rotations in numerous rural sites. And with that, we believe they will be more interested in staying in a rural area. So once again, an example where we came together to do something that neither one of us could do. And the last example I will give is we all know the tripartite mission within an academic health system is the teaching element. We just talked about the research, or I'm sorry, we just talked about the undergraduate education, we talked about the graduate medical education, and now we're gonna talk about research. Because we also set a goal for research, and that was really 2 things. One was we want to do research that will advance the health of rural residents. And we'll come together and we'll do that together. And I know Dr. Peter Crawford's here in the room, who's been just a wonderful partner in this as well. We do research now at Centricare, but not to the extent. Like the university is number 25, I believe, ranked in all educational institutions. I think you're number 11 in public institutions. Like obviously, we're nowhere near that. But I will say that our cardiovascular program is recognized as one of the top research institutes in the Midwest. So we, as I said, came together. How can we advance research that will advance the health of rural Minnesotans? The other is recognizing we also want to see the university's research rankings go higher. And so what we committed to is how can we structure the research that we do that can drive up your NIH grants, can drive up your Blue Ridge ranking, so it has mutual benefits both to the university and to ourselves. And then we'll add one last one. We haven't talked much about this today, but the other element of the tripartite mission is the clinical collaborations. And we do those collaborations today. Our orthopedic program is through the University of Minnesota physicians. But I think the best example I can give you is we now have University of Minnesota sending up physicians to do gynecological oncology at St. Cloud. There is not enough instances of that illness in our service area for us to have our own program. So we have to tell those patients, I'm sorry, you have to go to the metro to have your treatment. The reality is not everybody can travel to the metro, and not everybody can afford to be in the metro for multiple days, nor can they bring their family for multiple days. Now we're telling them, you know what, you can have that treatment, and you're gonna have that treatment done here at Centricare because UMP is sending up their experts to do that. So those are all elements where we are delivering on the tripartite mission. There honestly is no way we could have done that without what I talked about earlier. It's that trusting relationship, and it's that focus around how can we collectively do something that neither one of us can do on our own. And with that, I will turn it over to Ken for any comments he may have, and then we will finish with Dean Toller.
And I would finish with where I started. 2 things. Number 1, a shared commitment with a shared purpose to take care of our patients and communities. And right after that, a profound thank you. Mangatusentuk, Tuksumikit, Dunkashun. Whatever language we speak, health is probably one of our most important personal and collective objectives. And so thank you for supporting this work. Thank you, Dr. Toller and your team. Thanks to our CentraCare team. Right behind me is our General Counsel, Santo Cruz. This is the work that Mike and I are the front people for. You would not believe the number of people that have volunteered to help on this. Our clinical faculty to train our students is more than full. We have people standing in line. The number of people that have donated some $32 million now is remarkable and is still going. So thank you for being a trusted partner. Thank you for building a trusting foundation for us to do this. This is a leap of faith. And I would finish with this. A primary goal of a leader is to give oxygen to hope. We need more oxygen in these days. Thank you.
Thank you, Dr. Holman. This is so exciting. This is really a reflection of the fact that we believe in rural life, that we are here to make the rural life healthier, and we all have this long obedience to the patients, to the communities, to the colleagues, and everybody else. Everything that we do is happening in a greater context of things. Everybody is very well aware of the pressures from the federal, from the state, from the clinical partnership, and everything else. And it's important that, and thank you for mentioning the support of the Board of Regents for the medical school, because that is why we are top 25 medical school for 3 years in a row now, which has not been the case, let's put it that way, for decades. And it is, the reputation that the university brings to St. Cloud. And as a foundation, the medical school is necessary to be sustained, maintained, and really advance forward. It carries the accreditation, of course, and is the center where the innovation and the training and the high-quality clinical care, happens. So solving the challenges ahead, that's what we do. We lean like firefighters. We run to the fire. We run to the problem. And I'm profoundly grateful to both Dr. Holman, Mike, and everybody else, Santo, for this shared ability to commit and demonstrate success. Madam Chair.
Great, thank you very much, and appreciate your presentation. President Cunningham.
Yeah. First of all, it's wonderful to see both of you again, and I just want to add, my personal thanks for your partnership over for the year, as I learn more about this, as well as just, a statement on what the University of Minnesota Medical School can do to support rural Minnesota. And, you really did a beautiful job here in presenting with a lot of color and context on why that need is and what we truly can do when we partner together. And, I believe and have said since I've been here, we need to serve the state of Minnesota as the state of Minnesota's public medical school, and partnerships like this are a key part to this and important to deepen. I do want to call our attention here to this last slide, because I do think it is important for everyone to understand still, as much as the commitment is that you've made here on the financial commitment and context, and you've done all that you can. So this is a conversation really for my board, and not possibly that you could have done anything more. You've been amazing partners in every possible way. But the St. Cloud campus is not a medical school. It's a campus of our medical school, as Dean Toller said. It cannot continue at St. Cloud if our medical school is not strong, accredited, has the research and teaching components along with it. And so, as we've talked about over the year, we want to do this so much. We want it to expand. You have tremendous ways it can expand and how we can expand in other components of the state. All of that cannot happen without a strong foundation to our medical school. Even if money is poured in St. Cloud, without a strong foundation of accreditation, faculty research, our clinical training sites around the state can't happen. And so while we continue to build in earnest to do all the right things, as CentraCare has done and your leadership has done to make those possible, we, and that bipartisan support of your legislators, have to continue to understand that unless we support what happens here in the Twin Cities for our medical school, directly impacts our ability to do this amazing work across the state. And unless we secure the foundation here, all of that amazing work is completely at risk. And this is why we have to continue to do that work urgently that I spoke about with Lois Quam at the front end. But in the meantime, hope is important. We are working towards those components. And no better way to provide hope than to provide the reality of what can be done in rural Minnesota that supports the health of those communities and the health of Main Street when we work together to do it. So I really just have the deepest thanks and appreciation for you and your teams and the teams at the medical school that put together this vision. Things start with an idea and a vision and then are working towards doing it. And I want you to know I'm committed to making it work. I'm committed to growing it and to serving rural Minnesota in exactly the way that you speak of. And thank you so much for your leadership and for your partnership over the year. It's very impressive.
Thank you.
Thank you, President Cunningham. Regent Hipsch.
Thank you, Chair. And I couldn't agree with you more. Well said. And that's our job, is to support the Twin Cities and to get, to keep this medical school great. But I want to just speak to what you guys are doing, how important it is for the state. It's just, coming from a small town of Perm, okay, I talk about Perm a lot because of what I know. But first you get us doctors or nurses, then we'll get hospitals. And then people say, well, we were to get some schools because doctors are smart and they have smart kids. So then you start building schools, and then the whole business thing takes off. People say, well, we have good schools and good hospitals, let's expand our businesses. And, this isn't even part of the economics of this thing. And if you come to Perm, you're going to see, probably $1 billion worth of investment that's been made after we built the new hospital. I mean, and it's just crazy. And so we value add everything. So we're not shipping sugar beets out. We're shipping candy, and we're shipping potatoes and all value added stuff, dog food, licorice, cheese, you name it. And so that's what we do. And every town is like that in rural Minnesota. And it starts with that health care. I mean, if you can't take your kid in, take them out of school and take them 4 miles to the hospital, you're in trouble. You're going to live someplace else. And then we lose that worker. And so it's just, what you're doing is so bold and so great. I can't even tell you how much. It's what gets me up in the morning and coming to the Board of Regents meeting, because it's really, this whole all Minnesota care is really, really great for Minnesota. And we need to keep pushing the whole thing along. And what you guys are doing is fantastic. And I just want to thank you, because it's hard to be bold right now, and it's really hard to have a real bold vision, but you guys did it, and I can't thank you enough. So thank you.
Thank you.
Thank you, Regent Hipsch. Regent Verhalen?
Thank you, Chair Wheeler. I agree wholeheartedly with what Regent Hipsch shared. Seeing the challenges of those living in greater Minnesota, their access to healthcare through so many different lenses. This is such an important opportunity, both for CentraCare and the University of Minnesota, but also for greater Minnesota and their communities. And President Cunningham, your comments really drive home the point that's on the slide, which is without a solid clinical partnership, we can't do this. And we have to remember that the only 2 medical schools in Minnesota are the University of Minnesota Medical School and Mayo Clinic. And the University of Minnesota Medical School is the Twin Cities campus, the University of Minnesota Duluth, and now St. Cloud. And that's such an amazing reach for that program, and such an amazing opportunity for students that choose the University of Minnesota, no matter which campus it is. So I just wanted to express my thanks, but also please keep letting us know what more we can do to help, because this is critical. Thank you.
Thank you.
Any comments, Dr. Holman, about that?
Well, I remember very clearly when you and I met, goodness gracious, is that 6 years ago? We had not met, and we were at some convention center, and we had a brief conversation about it. So thank you for your kind comments. So the only thing I would add is that in the complexity of the environment we live in today, the way that our team approaches how we provide care, as both of you and all of you indicated in a challenging environment, is how do we make sure that kind of 4 things line up? And it's easy to say the 4 things. It's much more complicated to deliver on them. So number one is how does the business model work, right? because there has to be an economic underpinning to make sure that in today's economic world that we can float the boat. Secondly is at the end of the day, despite all of our computers, healthcare is clinical. It's about clinical relationships. So how do we make sure that the clinical model works, whether it's at the nursing level, to the pharmacy level, to the physician level? So that's the second thing we look at. Business model, clinical model. The third relates to this notion of a foundation of trust, but I would call it culture. There's this famous phrase that John Sen developed, said that culture eats strategy for breakfast, lunch, or dinner, or whatever you want to call it. And so this notion of how we develop trusting relationships and culture is extremely important. And the last is about leadership. And so it's very easy for me to say business model, clinical model, culture, and leadership. It is far more difficult to execute. But I thought that I would share with you from our CentraCare perspective, that's what we focus on every day. How do we make sure we have a sustainable business model with everything that we do? How do we make sure that the clinical model actually delivers on the needs for our communities and patients? How do we align cultures so that relationships are challenging. My wife and I just celebrated our 50th wedding anniversary. And that, I won't say any more than that, other than we've been together for 50 years.
Congratulations.
How do you develop a trusting relationship? That gets to culture. And the last is leadership. How do we make sure that we're in sync with our teams and there's a positive momentum? And again, thank you.
Well said. Regent Johnson.
Thank you. Well, again, I agree with everything people have said, and I'm not going to repeat that. Thank you for the comments about culture and the related things. Yeah. We've had some conversation about that before. Minnesota has been a largely egalitarian culture traditionally, where they don't like the haves and the have-nots, and it's that kind of. But I think of the assets that you have that might be really important for us, to President Cunningham's point, is the goodwill of your business and your political, communities. And I think that's part of what we have to leverage all around the state, wherever we're doing this good work, that you also help us by your ongoing communication with your legislators and, business leaders. And we should make sure this is not like, the Twin Cities is the big, and we're not the bad guys. I realize if you come from a smaller state, some outstate area, that can seem like, there's a big city, they have everything, but it's actually true that we have to work together totally on this. And so anything you could do, and I think here in Duluth, where we have the medical school campus, the pharmacy, and we've got tribal and rural education and awards for that. This is another wonderful opportunity. Thank you for all that you've done. But I think we need to really work together to consider that, how we have a political legislative strategy to bring all these diverse parts of the state together. And not be separate and apart, feuding. So I'm sure you're doing that, but just thank you very much.
Thanks.
Great, thank you. Student Representative Smith, I see your hand is raised.
Yeah, I just wanted to say, as a medical student myself, who is a current fourth year, who had the opportunity to do the RMSP program 5 weeks at a CentraCare site in rural Minnesota at Long Prairie, that everything that was presented today was I think very much in line with student priorities as well, from the housing to the fact that when students have those experiences in rural parts of the state, not only is it really fantastic for getting a better understanding of rural colleagues and how things go out there and the significantly different challenges, but also for retaining and making sure that students are having those experiences that really do significantly increase the chances that they return and stay to those communities. So thank you for the presentation.
Thank you, Pete. My cell phone number is, they have it there. I'd be happy to talk to you when you finish your residency, because we'd love to have you go back to Long Prairie or any of the communities that we serve. So thank you for your comments, Pete, and best wishes on your career.
The positive recruitment meeting.
Yes,
That's
exactly
good.
right.
Like that, Dr. Bowman. I'm going to go to Student Representative Arimu.
Thank you, Chair Wheeler, and thank you, Dr. Holman. Mike, thank you. And thank you for extending a hand of fellowship to my colleague, Pete. You see, first I want to say the storytelling technique of Mike was phenomenal. Somehow I was able to picture most of what he was saying. And I know Dr. Holman said something, that Central Care is the engine that did, not the engine that didn't. I'll tell you, at 5 a.m. this morning, 5 minutes past 5, I chatted with a colleague who is an international medical graduate, and he did his family medicine residency with you guys.
Oh, great.
Yes, and we had a very long conversation. Everything you said is correct. He said at the time, there were 3 international medical graduates that were taken at the time. And he went on to become the chief resident. That it showed to him that the center is welcoming and the training is top notch. I want to read some of the things he told me. Because I was saying it, I was typing it out. He said the experience with Central Care is so good. The quality of care is great. The enabling environment and education is superb. And so I want to say thank you and hope that we would continue to encourage acceptance of international medical graduates. I also want to add the piece of collaboration. Collaboration is everything, obviously. No one does anything alone. And so for everyone involved, you guys, Dr. Toller, the board, the university leadership, the state of Minnesota legislature, donors, taxpayers, the community themselves, everyone involved. It's a great success. You see, rural care is very important to me. 19 years ago, 2004 specifically, I was in medical school. I was my second year in medical school in Nigeria. And there is something we do then. There is what we call COBIS, Community-Based Experience and Service. It's a WHO collaborative project. Every medical student in your second year will be posted to a rural community. You will go live there for at least 4 weeks to figure out what their problems are and provide a solution, maybe healthcare-based, policy-based, or what have you. And so I don't know if we do that here, but it's something that can be incorporated. That way you have most folks in training who are willing to go back to rural healthcare. And so for me, rural healthcare, it's an heartbeat for me. And so seeing what you're doing here is something that I really do appreciate and hope that continues. One more thing I hope to add, 1 second. And then there was another thing I took note of, which is modeling the way in terms of retaining your product. I really do appreciate the fact that this section, we've had this talk before, that you retain all is great. I mean, that's something everyone should model. I haven't trained your folks, to be one of the best folks, best doctors. You don't want them to leave and consider coming back. You give them the opportunity to stay. And the fact that the medical school is modeling the way, I think it's something every other department and sections of the university need to learn from. That way, beyond retention, you keep the training. That shows your faculty are really good for you to be willing to keep them. So beside that, the economic value you get from that is essential. And the fact that, you train them, we see what the needs are, then we're willing to give back to the community. We help the healthcare system, we help the health of our folks in Minnesota. And so I want to congratulate the medical school, honestly, for what you've done in that aspect. And Central Care, great partners, wonderful. And I hope other units can honestly do the same thing. And at that, I think I would like to stop there. Thank you.
Thank you.
Thank you. I really appreciate your comments there. Just add just a quick aside there too. If you look at the hospitals in Minnesota, and if we look at the health systems that are kind of anchored in Minnesota, and so I'm going to take Mayo out of this equation here. Mayo does wonderful things, but with their worldwide destination focus, they're a little bit different than the other hospitals. So if you look at which hospital has the highest case mix index, it's UMMC. If you look at who has the third highest case mix, it's St. Cloud Hospital. No, and this is based on the Medicare data. And then if you look at the number of patients that are being treated, we actually treat more patients in St. Cloud that get treated at UMMC. And when you measure that combination of case mix index in the volume of patients to say what are the largest complex care facilities in Minnesota, University of Minnesota Medical Center is number 3. St. Cloud Hospital is number 2. So to your point, Regent, part of having that ability to both train them at St. Cloud, the second largest complex care facility in Minnesota, and be able to do rotations at the University of Minnesota, that's really about making top-notch doctors who will get the experience here in the metro, here in the rural area, and will stay in Minnesota. That combination, I think, is going to yield some wonderful physicians. We have wonderful physicians today, but more who will practice out in outstate Minnesota.
Thank you. Thank you. Thank you very much. And Dean Toller, do you want to speak to Tyrell Raymond's comment about rotations in Greater Minnesota?
Dr. Emmer, thank you very much, Madam Chair, for that comment. A couple of things that you said, are very profound. First is that we have always looked at the diversity of talent, and that can be the tribal, nations that Regent Johnson, said. It can be veterans. We do the military medics to medical school pathway. And I have some understanding of the international medical graduate because I'm one as well. And it has been a staple, of what we do in all of the programs, not just in St. Cloud, that we invite, and embrace, the diversity of thought and backgrounds and lived experiences. As a part of and I like that you shared the model in Nigeria of these, I have to learn more about this, the COBIs. We have, our predecessors have started something very similar here. It's called Rural Physician Associate Program. It started in the early 1970s, recognizing exactly what you just said, which is it's very different to stay for 6 to 9 months in a small settlement, small city, small community, and serve them, not as a one patient, 15 minutes, kind of appointment, but really the whole family. You see them in the supermarket, you see them on the farm, your kids go and play, with their kids as well. You sort of get it. And we have now more than 120 locations across the whole state that are populated with these trainees that go for an extended, period of time. So if you can sort of get this all together, it comes back to what Dr. Holman and Mike, talked about, that it is really, we are getting ready for future, because what's going to happen is as opposed to the brain drain that we have seen from the greater America to the cities, the opposite is going to happen, because most people want to stay and will stay with their ailments, chronic conditions, at home. They will actually not have to cross 694 to do that. A lot of the, prevention is going to be done locally. And the innovation that we bring to the care models with the learning health system and AI and other things that we are now sharing with St. Cloud is exactly what's going to decrease costs, improve access, to your point. My last is that you spoke about how the medical school needs to stay strong and, how we need to build all that. I want to be very clear that the way we are going to stay strong and maintain our position, at on the leading edge is exactly through partnerships like yours. So it's not one-way thing. We get better because of you, and I'm forever grateful.
Great.
Madam Chair.
Thank you very much. Seeing no other comments, I'll just make a few of my own. First of all, really, really appreciate, as Dean Toller said, and as we know, the commitment of this university to the state's need in rural Minnesota is profound, and you have helped us expand that in significant ways. So thank you right back. And I think it's a large part of the vision for the Minnesota healthcare is to really further, rural Minnesota and serve it as well as possible and not have these care gaps that exist out there that, and grateful for your focused graduate medical programs too that are filling those gaps. So thank you for that. Thank you too for your unique financing of this that allows it to be more sustainable, and your partnership on all the 4 levels that you talked about, Dr. Holman. So appreciate that as well. I think it has to be noted what President Cunningham said. We're getting basically an assault on, financing for all of higher education, including our academic health piece. And so it's incumbent upon us through how we act as a university, what partnerships we form, what society does, how the state invests in these things to keep that strong, because if that foundation which is fragile right now, is weakened, then these wonderful partnerships with wonderful partners like you get to be more difficult. So I think we have to look at that too with eyes wide open. But just appreciate everything, and you are a model of what a true partner in this practice, advancing care in the state, looks like. So thank you for that too. So tusen tak, back at you. All right. With that, any other comments at all before we go? Regent Johnson.
Yeah. Again, thank you. I just want to say I'm really very enthused about this. I think it would be wonderful as we look at opportunities as a Board of Regents to get around the state, that once you're kind of settled in and you've got things going, it would be a wonderful opportunity for the board to come to St. Cloud, to see the campus, to meet people, have you show us around there, talk to students, but also your community leaders, business leaders, legislatures, whatever, and learn, so we can listen and learn from you how we can continue to enhance this partnership and strengthen it. So we look forward to doing that. Yes. And I'll just add one little, hope this is in humor, of course, but you never know what happens. So sometimes the Mayo Clinic is talked about as the miracle of the cornfield, because it's an incredibly unlikely story. So 1883, Category 5 tornado rolled through Rochester and practically destroyed the city. A lot of people died. And a diminutive Franciscan nun from Belgium came to William Worrell Mayo, came from England to kind of be a primary doc around the country. They came together, and 6 years later, St. Mary's Hospital was opened. And I'll just say the rest is history, but you just never know when you start something in a rural area and do it well. I mean, I just think that's, to keep in mind. Minnesota has different ways that we've done things, but I think this is really absolutely wonderful, and support it fully. And I think it's important to be mutually supportive of one another to make this happen. And I do share the President's concern. We have to work diligently to have that happen. Yeah,
great.
Thank you.
Thank you, Regent Johnson. And
I make a brief comment. Thank you.
Yeah.
So my grandmother died at the Mayo Hospital.
Good.
She was from a small town in Iowa, had metastatic ovarian cancer. And so for years I've had friendships at Mayo, including yours, but John and now Jean-Rico. And we actually have a Mayo executive on our board and have had for years. Our board is a little bit differently than a lot of health systems. We try to look for competencies, so it's not just local folks, we're getting a broad perspective of diversity and thought. And as I like to remind our Mayo colleagues is that U.S. News and World Reports lists Mayo as #1, and in the state, CentraCare is #2. So we're coming strong, and we're getting there.
All right. And Dr. Holman, do you want to remind people of an event that's in later July, some ribbon cutting that's going on?
Yes, so we have, I actually have Mike give the details. So we first class coming, we have a ribbon cutting. We're going to have a block party, if you want to call it, to celebrate the new medical school and the campus. And yeah, it's fun.
There's a chance for experiential learning that day, July
We'll get you the
27th.
All the details to you, and the dates and the times.
Yes, just
I would,
to us, because
and in the same vein as thank you, we have asked, Santo has been leading this, a lot of people to make a video saying thank you. It's not ready to get to you, but when you see it, it's going to be just a hoot and a holler. That's an Iowa phrase, I am sorry. But there'll be a lot of people saying thank you in lots of different ways. And we'll send it to you, and I want to make sure that each one of you sees it as well, because it expresses the deep felt gratitude of our leaders and our citizens and our farmers and our business people to say thank you. That's the last word.
Yeah, thank you. Appreciate you. Great. With that, and I think no other comments being said, we'll adjourn this meeting. Thank you so much.